Hello, everyone. This is Professor Rivera, and I am going to be going over Chapter 13, which is psychological disorders. Now, the first thing I want to talk about when we talk about psychological disorders is that in some of the later videos, I'm just going to be discussing, this is what this disorder is like, these are some of the symptoms, and you will inevitably start to think, I have that. My mom has that. My friend has that. It's very common to have that emotion because we all have quirks of personality. And sometimes a symptom sounds like a quirk. And if you are not careful, it's very easy to self-diagnose yourself with just things that you do not have, or diagnose people with things that they do not have. With that in mind, then you probably are thinking, then what's the difference? How is it that some people have a symptom and I kind of feel like I have that same thing, but it's not a symptom. It's just a little quirk of my personality. Well, there's three things that you would look at. A symptom could be deviant, and deviance means that it's either atypical and it's considered unacceptable. The easiest way to think of something that is deviant is that it's mostly wrong. Lying, hurting others, manipulating others. These things are deviant. Maybe someone likes to expose their naked body to people who have not consented. That is deviant. Most of us agree that even if that person feels okay about what he or she is doing, the rest of us agree that that is not okay. It's wrong. And so therefore, we would consider that behavior deviant. Now, some things are not deviant. They are maladaptive. And something would be maladaptive when it interferes with your life. If you can't go to work, if you can't be around your friends, if you can't be around your family, uh, if you can't succeed normally in your everyday life, if uh, just things interfere, right? Your little quirks or symptoms interfere with your life, then that thing is what we would call maladaptive. It doesn't allow you to function correctly in the world. Now, some things are not deviant, they are not maladaptive. What they are is that they cause personal distress. That is a great deal of anxiety, sadness. Uh, you just are always thinking about it. You feel disgusted with yourself, or you just feel disgusted all the time in general. These things are causing personal distress. Now, something is deviant, maladaptive, and personal or causing personal distress. Can't just be something once in a while or random. When something is a psychological disorder, it is constant, and depending on the disorder, we're looking for something to last 2 weeks, a month, a year. Um, every disorder usually suggests that there is a time that it must occur before you can be diagnosed with it. And so we're going to talk a little bit about that throughout. Now, another issue that is important to talk about when we talk about mental disorders is how we kind of diagnose them. Now, in the United States, we use the Diagnostic and Statistical Manual. Um, the past one was a DSM-4TR. We're actually on the DSM-5, and I'll hit that on a different slide. But what the DSM, or the Diagnostic and Statistical Manual, allow us to do is to have a common language to talk about mental disorders, and kind of give us guidelines as to what disorder is which. And usually there's a lot of research that goes into the DSM. Uh, all of the different versions. As I mentioned, we are on the 5. Now, I'm also going to focus a lot on the diagnosing in relation to kind of what field. Sometimes we diagnose things through a biological or a medical model where we talk about what's happening in the body, what's happening in the brain chemicals, neurotransmitters, hormones, um, what is going on in the body. Sometimes biological might lead us to talk about uh, genes or genetic makeup or just how a disorder affects your body after the fact. All of these things are biological issues. Of course, we could talk about it from the psychological perspective. What are the behaviors and the thoughts that are going on when we say a person has a mental disorder? And so, psychological includes things like what are you thinking about? What are you hearing in your mind? How are you behaving? How are you reacting to things? These are psychological. And then, of course, there are sociocultural factors like when you feel bad, do you go to the therapist or do you go to a religious leader? That would be a sociocultural factor. Um, where do you get your knowledge from? Is it from at home or do you go to school? You know, who decides that you are sick? Is it a medical doctor? Is it a political uh, person? Is it a family member? We would like to imagine a world where every time someone is diagnosed, they're going through what we would call the biopsychosocial model. That is, this individual's biology is taken into account, this individual's psychology is taken into account, and their sociocultural factors are taken into account. Unfortunately, we don't really live in that world. We try hard, uh, but more and more people get more specialized. And if you're a psychologist, if you're a therapist, there's a good chance you're focusing a lot more on the psychological and sociocultural factors. If you're a psychiatrist or a medical doctor, there's a good chance you're focusing on the biological factors. So, especially when people deal with mental disorders for a long time, they sometimes have a psychiatrist and a psychologist. They have counselors and they go see their medical doctor. You may have noticed that, especially in our culture, we do kind of weird things every once in a while. Someone will ask you to wear a ribbon of a specific color for disorder that we are trying to help out. They might ask you to walk for life or to be, show your support for autism awareness or to throw ice over your head for ALS. And you might think that's a weird thing that we do, but it's in fact quite important because there is a natural human tendency to be afraid of things you don't understand and to just sort of create an other type of grouping. And so we go, oh, those people over there are different. And it wasn't that long ago where if you had cancer, you never told anyone you had cancer because it was shameful. And even your good friends wouldn't know. Maybe your family would know. Eventually, when you got really sick, they might put you in a back room somewhere. And if people came to visit, they would close the door so that the visitors wouldn't see you. Um, Disorders and illnesses often come with stigma. That is like a mark of shame. And usually people try to avoid others with that kind of stigma. In the psychological world, you may have heard that people think of individuals with mental disorders as being crazy or being dangerous. These are just stigmas. And unfortunately, those stigmas can be very powerful. Sometimes people will be denied jobs. Friends will stop talking to these individuals. Uh, those things can be quite negative. Now, the opposite of a stigma is that, in fact, when people get diagnosed with mental disorders, so long as they're getting the right kind of help, it can be their saving grace, right? So long as you're getting the right diagnosis. And so sometimes people will say things like, oh, what I have has a name. You're telling me I'm not the only person that is dealing with this, and that can actually be quite a relief to know. But a lot of people don't get to that part. They don't get to the diagnosis or the treatment because they're held back because they don't want to be stigmatized. Now, I want to talk very briefly about the DSM-5, that is the Diagnostic and Statistical Manual number 5. Now, you may have noticed that the DSM is the DSM-5, and in that other slide, I mentioned the DSM-4TR. The DSM-4TR is the edition that we were at before we got the DSM-5 in 2013. But you'll notice that the DSM, the first one, began in 1952. And in fact, that was just like a little pamphlet compared to the DSM that we have now, which is quite thick and expensive. Throughout the years, uh, there have been revisions and changes to the DSM. And of course, the last one that we have is the DSM 5, which focuses a lot more on the biological model and sort of changes around some of the ways that we look at um, the different disorders and the way we diagnose them and the way we group them. That was a big change. Uh, Groupings changed in the DSM-5. Now, one of the things that went away is what used to be called the access system. That is, instead of being diagnosed with one disorder, you got diagnosed essentially 5 separate times with a psychiatric disorder, a personality or developmental disorder, a medical disorder if it was there, a psychosocial stressor if there was there, and then some level of functioning. This presented a lot of problems. The first one is that it's super confusing. And the most real one is that functioning it often led uh, companies like insurance companies from not wanting to pay for the individual's uh, treatment, right? If the psychiatrist said that you had pretty high functioning still, the insurance company would not want to pay. Sure, later, if you don't get the treatment, your functioning might get worse, but right now it's high, so why would the insurance company pay? And so it created a lot of problems, again, for the students, for the doctors, for the patients in real life. And so this was done away with. Now the diagnosis is a lot more closely related to just a normal medical diagnosis. Okay. Also, it's been aligned better to the World Health Organization. As I mentioned, the access system is gone, and except for things like PTSD or acute stress disorder, the stressors are not as important in the diagnosis itself, although they may be important in treatment or other parts. They are not necessarily important in the diagnosis that someone gives you. Okay. Now, a lot of people deal with symptoms of mental disorders. About 48% of adults experience symptoms at least once in their life. And um, that's a lot, but that doesn't always mean that 48% of people deal with diagnosable mental disorders. But they do most people deal with, at least in a part of their life, some issue that is quite painful or traumatic or confusing, and it creates symptoms of mental disorders. With the right coping mechanisms, a lot of people deal with those, even without having to go to a therapist. Unfortunately, sometimes if you don't have the right coping mechanisms, if you have other issues on top of the symptoms that you're developing, those things can kind of compound. And what was a small symptom, because of a very specific part of your life, can get worse and worse. And of course, what we know is about 80% of people who experience symptoms never seek treatment. And so when those issues compound and compound, a lot of them deal with uh, kind of becoming mental disorders. Now, there are differences in uh, ethnicities and genders. Um, one of them here I have is women tend to have higher prevalences of depression and anxiety. Men tend to have higher prevalences of substance abuse and antisocial personality disorder. And we're going to talk about more than a handful of those throughout the rest of the videos. Okay. Um, okay. In